I'm Janice. I'm Cystic Fibrosis Specialist Practitioner at the Royal Manchester Children's Hospital. I've been looking after children with cystic fibrosis for the past 13 years, from age ranging 0 up to 18 years. I look after children with cystic fibrosis from birth right through to transfer over to the adult services. Lots of those young children and young people living life with cystic fibrosis quite well at home, and we just see them in clinic every sort of 8 to 12 weeks as they need to be seen. But we also have patients with cystic fibrosis here on the wards who may be a little bit more poorly and are needing treatment with intravenous antibiotics. So we see quite a range of patients from healthy to not so healthy. My job involves looking after patients with cystic fibrosis and their parents and carers. So I offer more of an advisory and supportive role. So we look after children from time of diagnosis right through to when they're transferred to adult services. We're usually the first point of contact for the families whenever they need any advice or help or any sort of psychosocial input. If the child's unwell, they will usually contact us, or if they need any advice, they will contact us and we'll arrange for any members of the multidisciplinary team to see them. We have a national newborn screening programme now for cystic fibrosis, whereby all babies that are born in the UK are screened for cystic fibrosis, and blood is taken at day 5 of life and tested to see whether they have cystic fibrosis, which can be quite traumatic for mothers because they usually get a cold visit from a health visitor advising them that their child may be suspected as having cystic fibrosis, and they're then brought up to the hospital where we do further testing, and we will either confirm the diagnosis or send them on the way without confirming any diagnosis. And all that's done within sort of 24 hours from seeing a health visitor, so it can be quite traumatic for the families when they're brought up that way. But we're here to sort of offer the support and give them information, and we see them when they're diagnosed. We see them quite frequently within the first few days, and then we see them every couple of weeks, and then we'll see them in clinic monthly, so that they can learn all about the condition and what care they need to give the child so that they have the best possible outcome. I look after children with cystic fibrosis from time of diagnosis through to them moving on to the adult centre at 18 years of age, and we build up quite close relationships with the children and their families over this time, because they look to us for support and advice and help, and for sort of troubleshooting any worries that they may have over the years. And we have lots of patients, some that do really well and they go on to the adult centre and they're living their lives normally, and they're just CF is a small part of their life. But we have lots of children who maybe don't do as well and they're spending a lot of time in hospital. And unfortunately we still have a very small number of children and young people that don't actually make it over to the adult centre at all. And that can be upsetting and traumatic in this day and age. So, as you know, there isn't a cure for cystic fibrosis, and CF primarily affects the lungs and the digestive system. So the aim is to keep the lungs as healthy as possible and to ensure that the children and young people gain weight so that they grow and they stay healthy. So the things that they need to do for the lungs is they take antibiotics, and that can either be by mouth or inhaled into the lungs or intravenously through a drip. Some children come into hospital to have that done, and a lot of our kids are doing that at home, whereby the parents or the young person themselves will learn to reconstitute and administer their own antibiotics and then give it to themselves. But a lot of children do come into hospital for 2 weeks every 3 months, so that has a big impact on their lives and schooling and their home lives and parents' work and things. So they take antibiotics every day, basically. They also have to do chest physiotherapy twice a day, which helps clear the mucus in the lungs and keep them healthy. We recommend that they do lots and lots of exercise, which will help improve their lung function and also get rid of the mucus in the lungs. And as the disease progresses, if they're getting worse, a very small number of children referred on to the lung transplant centre for lung transplant. Unfortunately, not many children go on to get a lung transplant because we don't have enough donors for the amount of lungs that are required in the UK. From a digestive point of view, about 90% of children with CF don't produce their own enzymes that we need to help digest food. So they have to take enzymes artificially to help them digest food and to grow and gain weight. So they can be taking huge amounts of medication on a daily basis to help them absorb food, and if they don't do that, then they won't grow. And they also take lots of other things like vitamins, and they have to have a high fat, high calorie diet, and some children can't maintain the weight themselves, so they need to take extra oral supplements or maybe fed in another way to help them gain weight. I've been looking after patients with cystic fibrosis 13 years now. It's very rewarding. We get to build up a really good relationship with the children and the families and their carers, and because they've got a chronic illness and they're always coming back to hospital, we see them on a regular basis. You always know who's coming along, and most of the families like to think of us as an extension of their family and somebody that they can turn to at times of support. So it's a special relationship that we have with them, and it's quite hard when they move over to the adult services because we no longer see them then, and any contact is stopped, and they're just basically getting on with their lives then. But it's good to know that they are growing up and they're moving on into adulthood. There aren't many children and parents who come and ask us about gene therapy, and we don't push it because we don't know how far it's going to go and whether it's going to be successful. So it's not something that we offer as a treatment, because it'd be almost like promising a cure really when we know that there isn't one. However, over the years and in the 13 years that I've been working here, we've got some amazing new drugs and therapies that have come on the market that we're able to use in children that have had a huge impact on their health. And so, although it would be wonderful to think that there might be a cure in the future, it's not something at the moment that we're able to offer to our young people and children and their parents.